being recorded. All right, so as I said, welcome to the HPV Vaccination Learning Collaborative. My name is Shante Davis Patterson, and I am the Program Director for California's Comprehensive Cancer Control Program. We administer the State Cancer Coalition, the California Dialogue on Cancer, or CDOC, and CDOC is one of the co-founders of the California HPV Vaccination Roundtable, and I'm one of the coordinators for the roundtable. Thank you for joining us this afternoon. Little housekeeping here before we get started. So all participants have been muted. When we do get to the section where we'll have our discussion and sharing, you'll feel free to take yourself off of mute. Please ask questions in the chat.
I think you muted yourself accidentally, Shante.
Thank you. As I said, the webinar is being recorded. And lastly, there will be an evaluation link that will be dropped in the chat, and we'll also email it to all participants. And we'd really like everyone to fill this out. So please fill out the evaluation for us. It's a short form, and you can also enter to win a $25 Amazon gift card. Next slide, please. All right, so we're going to do a quick poll here. Now, what's the best pizza topping? Now, I know there's a lot of toppings, and typically you want more than one topping on your pizza, but if you have this blank slate and maybe cheese, what is your favorite topping? Let's just hear from everyone here. All right, it looks like it's kind of a tie between pepperoni and mushroom. All right, couple more seconds here. Wow, okay. So we're gonna end the poll now. I think we've gotten most people who have participated, and it looks like the winner is, actually it's a tie between pepperoni and mushrooms. And then I was expecting that pineapple would be last, but actually sausages. So, well, thank you everybody for sharing. All right, next slide, please. This learning opportunity is being brought to you by the Engaging Health Systems and Providers Work Group of the California HPV Vaccination Roundtable. And here's our agenda today. I'm doing the welcome here. We are going to go over some resources on the California HPV Vaccination Roundtable website. And we'll also talk about some on the National HPV Vaccination Roundtable website. We'll also hear about HPV infection, vaccination, and the role of the dental community from one of our own, Dr. Alessandro Villa. And then we'll have our Q&A period and a collaborative discussion, and then we'll close. And now I'm going to turn it over to Dr. Susan Park, who is one of the co-leads of our Engaging Health Systems and Providers Work Group. She's the Assistant Clinical Professor and Division of Gynecology and Oncology at Harbor University of California, Los Angeles. And she also represents 2 professional organizations on the roundtable. So I'll turn it over to Susan.
Thank you everybody for joining us. So I have to say, I really appreciate the feedback we got from our last poll. So a lot of folks were interested in just learning about kind of resources that we have available. And so we thought it'd be a good idea to kind of go over what we offer here from the California HPV Roundtable, but also some electronic resources that you can get from the national as well as the CDC. So I'll just spend the next 10 minutes or so kind of going over that. So I'm going to share this first screen, which is our roundtable. Can you guys see all of that? Okay. So basically, this is our California HPV Roundtable, and by way of introduction, we're a diverse group of stakeholders. And a few years ago, we got together to think about what are the priority areas that we want to consider to improve HPV vaccination. here in California. And so there are three emerging areas. The one that we're participating in right now is this Learning Collaborative, which is our health systems outreach group. We have a group that looks at kind of parent-targeted social media campaigns for community awareness that hosted HPV Vaccine Week. And I want to highlight some of the data on the website. We've had this wonderful data work group that has curated basically HPV vaccination rates as well as incidence of HPV-related cancers across California, so that if you're a health system starting off and wondering what your baseline rates are compared to other areas in California, you can do so. So let's
Susan,
see.
wait, hold on. Are you sharing your screen right now? Because it's on.
I am.
Okay, it's on my screen. Let me stop the share so you can.
Oh shoot, I'm sorry. Oh dear. Okay.
There you go.
Okay, can you see it now?
Mm-hmm.
Okay, so there's basically there's three areas that we talked about highlighted on this website, and we each have a link off the same page. But I did want to highlight, let me see if I can minimize the things I can see, are the reports that we have. So we have a data work group that looks specifically at California level data broken down by each county. And so I'm going to switch to that right now so we can see. I don't know if that switches over if you do that. Sorry, I have to save these here. Oh, I might need to just load it back on. Okay, I'm going to put one of the reports so that you can see. Is it following along? Okay, so can you see these reports that are, I just wanted to point out the graphs that we have so that if you're looking for information about your health system, you can rely on this graph to show, okay, according to my district, which is, LA County, here's where I stand relative to California in general. And so in fact, a little bit small, but it's a reference that you can turn to see how am I performing relative to other counties or other health systems here in California. And so we want to grow this website over time based on your feedback to include resources that would be helpful to your health system. And the thought was that as you develop your own tools and want to share them, that this could be a landing page for that, where you could email us that resource, you can upload it, highlight it. If there are certain events that you want to promote, you can try to do so across this website. So I want to go on next to our National Roundtable website. I'm sorry, I didn't realize that the top bar would be hidden. Let me see if I can get to it. Excuse me. All right. I had cool out. Okay. So this is our National HPV Roundtable. Can you see this one? And so this is in a national version of the California Roundtable. It started first with the same goals to try to improve outcomes, but they have a very robust resource library. And it's such so that you can actually search for what you're specifically looking for, looking at things that target clinicians or health systems or state and local coalitions, and what kind of media you want, whether it's just brochures or handouts or actual guides. And so I got the ones that I want to highlight for our health systems group are these action guides. And so what's neat is that they have developed these guides dependent on kind of where you want your engagement, whether it's with providers, whether it's nurse or medical staff, dental providers, as well as your administrative front office, because we know that it takes all of these different levels of providers to achieve improved HPV vaccination rates. We also have guides that are specifically tailored for small clinics, as well as larger health systems like Kaiser. And then they have some new PowerPoints that you can kind of take your staff through to go over, what are ways that we can improve HPV vaccination through our clinics. And then the last thing I want to mention are this YouTube link. And they had some really neat videos that include some of the National Summit meetings, but they had some that are designed to be videos that you can play in the living area as ways to kind of counsel patients or increase knowledge about HPV vaccination from various perspectives. So this might be a free, helpful resource for you to have. in your clinic. And then the last thing to wrap up is the CDC website. So a couple folks were asking on the call, if I can get to it, excuse me, about how do we talk to patients and how do we talk to parents about, let's see if I can, about how do you script it. So the CDC has a nice script of how to do so. So we have a website that goes from the HPV page that goes over different information. It was nice is that it's in English and Spanish, and then they have actually vaccination material in different languages, not just English and Spanish, and there's a VIS portal, so you would be able to access that. The last thing I want to go over is that they have this nice kind of scripted counseling session of how do you answer the questions that the parents ask them. So when is my child need the vaccine? This is an appropriate answer. What diseases are caused by it? It kind of goes through some of the things you might have concerns about. I'm worried my child will think that getting this vaccine will make it okay. I think it's cut off on my screen here. And then is it safe? So this is a tool that you can use either by directly to the website or printing out this handout that goes over a scripted version of how to speak to parents and patients about vaccination. So I can stop there and see if you have any questions. But this is hopefully an introduction to explore these different websites to serve your needs for your resources. All right.
Do we have any questions for Dr. Park?
Okay.
Okay.
All right, so we'll move on to the next part of our session. So I'm going to be introducing Julie. You guys are probably well familiar with Julie, who is my colleague for this Engaging Health System. So she's the executive director of the UPV, the Comprehensive Cancer Center's Office of Community Outreach and Engagement, as well as the professor. She'll be monitoring the Q&A for our speaker. So again, I appreciate the poll feedback because we asked Dr. Villa to do this talk because of April being oral HPV cancer month, or oral cancer month. And so we want to highlight some of the HPV awareness around what that's provided to and oral cancers in general. So Dr. Villa, who is currently the chief of the oral, I'm sorry, my screen is a little cut off here. I'm going to pull it up here. The oral medicine clinical program director at UCSF. He'll be doing a recorded talk. Unfortunately, he had to do some clinical duties last minute, so he was kind enough to record this talk, which means that we will be able to do a discussion after that. We'll try our best to answer these questions collaboratively, and if we can't, we will be recording them so that we can send it back to him for clarification and feedback.
And I will be getting his bio in the chat shortly.
Okay, so I'm gonna start the video, and then if you have, let me know if there's any audio issues.
Hi, welcome. My name is Dr. Alessandro Villa. I'm the Chief of Oral Medicine and Director of Oral Oncology at the University of California, San Francisco. Today, we're going to talk about HPV infections and their association.
Julie, the audio just cut out.
And HPV vaccination. When we look at the number of cancers caused by HPV, we see that the majority of these cancers are oropharyngeal cancers in the male population, followed by cervical cancer. But HPV persistent high-risk infections can also cause cancer of the vagina, the vulva, anal cancer, and penile cancer. Oropharyngeal cancers, most of them are caused by HPV high-risk type infections, in particular HPV 16. And these are projected rates of HPV related oral and oropharyngeal cancer and non-HPV related cancers released by the American Cancer Society at the beginning of this year. And as you can see here, we are going to have approximately 54,000 new cases of oral and oropharyngeal cancers. And when we look specifically at the oropharyngeal cancers, we know that more than 70% are associated with an HPV persistent infection. So the CDC is telling us that HPV-related cancer rates are rising at about 45,000 new cases a year. We know now that oropharyngeal cancers in the United States have surpassed the rates of cervical cancers. And we have a vaccine available that can prevent most of these cancers. And in addition, recent studies show that the dental community, including dentists and dental hygienists, can be advocates or even vaccinators to prevent HPV-related cancers. I'd like to focus in the next few minutes on oropharyngeal cancers. These are now the most commonly associated with HPV. And dentists and dental hygienists already performed oral cancer screenings in their patients, and they may educate their patients around also HPV and the association with cancers, in particularly oropharyngeal cancer, given the anatomic proximity with the oral cavity. And we know that oropharyngeal cancer is associated with tobacco smoking. There is a synergistic effect with heavy alcohol consumption. Patients who are immunosuppressed are also at risk of developing an oropharyngeal cancer. But again, the majority of these cancers are caused by HPV persistent infection with HPV 16, followed by HPV 33, 35, and 18. These are the four most common, but as you can see here, the majority is really caused by HPV 16 infections. There are a large variety of HPV types. Some of them are what we call high-risk types that are associated with cancers, and low-risk types, which are associated with genital warts or warts of the oral cavity in the forms of verrucas or papillomas, and we'll see some practical examples in the next few slides. So what is the risk of a patient of acquiring an HPV infection in the oral and oropharyngeal area? This risk is higher in patients that perform oral sex, and the risk is greater in patients that have a larger number of oral sexual partners. So for example, if you look at men and the number of oral sexual partners, we see that if these are greater than 5 and patient is also a smoker, the risk is elevated, and the risk specifically of having an HPV infection is about 4%. So 4% of males who have at least 5+ oral sexual partners that are current smokers, the prevalence of HPV 16 is 4%. So we see here two important things. One is that HPV is a skin-to-skin contact infection, and that smoking increases the risk of having an HPV infection in the oral cavity. So what are the main risk factors and signs for HPV-related oropharyngeal cancers? Typically, patients complain of a sore throat that doesn't go away. They have difficulty swallowing. They have trouble moving the tongue right and left. And they may present with a lump unilateral of the neck or in the mouth, changes in voice, and fatigue with enlarged lymph nodes and weight loss as time goes by. These are two cases of oropharyngeal cancers that are HPV positive. One is a tonsillar P16 positive cancer, and the other one you can see here, an ulcerated area of the oropharynx, both of which were HPV related. This is another classic sign. This is a patient that we saw recently in the clinic, presented for a dental cleaning, and he had a unilateral mass in the neck. Patient was seen by an ENT. They performed a biopsy, and turned out that he had metastatic HPV-related right tonsillar cancer. But as I mentioned earlier, HPV can also cause other lesions in the oral cavity. These are caused by low-risk type HPVs, like HPV 6 or 11. This is a case of squamous papilloma. The patient had 2 lesions of the palatal mucosa. This is a patient with condylomas caused by, again, HPV 11 and 6 and others. And this is a verruca vulgaris of the left tongue caused by usually HPV 2, 57, and 4, and other genotypes, all of which can be excised surgically, and typically the surgical excision brings to a complete resolution of the lesions with restitutio ad integrum of the epithelium of these patients. These are another benign. This is another case of a benign pathology in the same patient with multiple nodular lesions caused by HPV 32 and 13. This is what we call HEC disease. So what can we do to prevent these cancers? We have a vaccine available in the US. It's the Gardasil 9. It's a 9-valent vaccine, which back in June of 2020 was approved also not only for cervical cancer, but the approval was extended also for other HPV-related cancers, including oropharyngeal, anal, vulvar, vaginal, and other small subset of head and neck cancers. So we have a very powerful tool that has the ability to prevent HPV infections and therefore to prevent HPV-associated cancers. And the CDC recommends that 2 doses are given between the age of 11 and 12, although they can be started as early as 9 years. And catch-up vaccination is recommended for all patients through the age of 26 years, although this vaccine is also recommended in high-risk patients after a discussion with their primary care physician up to the age of 45 years. So the question is, why are we talking about dentists and cancer, and why are we talking about dentists and HPV vaccinations? Well, Oregon was the first state back in 2019 to allow dentists to provide any vaccine to their patients, including the HPV vaccinations. And then more recently with the COVID-19 pandemic, dentists were also allowed to provide the COVID vaccine in multiple states, along with the flu vaccine. The flu actually started several years ago in Minnesota and Illinois. And now more and more states are releasing authorization to allow dentists to not only administer the COVID vaccine or the flu vaccine, but also the HPV vaccine. Massachusetts is one of them, for example. There are certainly certain barriers that needs to be addressed in having dental providers administering vaccines, including the HPV vaccine, which are reimbursements, whether or not it's part of the scope of practice, reporting of vaccinations, coverage in terms of malpractice, and also vaccine storage. However, things are changing rapidly, and we now know that, as I showed you earlier in that map, that several states allow dentists to provide the HPV vaccine in their patients. This is an interesting study that came out a couple of years ago, and parents in dental practices were asked whether or not they were comfortable in having their dentist in communicating about the HPV vaccine. And it was interesting to notice that almost 90% of the parents never received any information on HPV by their dentist. However, they were very comfortable in receiving recommendations about HPV and the HPV vaccine by their dentist or their kids' dentist. And you can see here, it was approximately 80%. And 63% of these parents were also comfortable with their child receiving HPV vaccination during a routine dental examination. We also more recently, a few months ago, asked dentists whether or not they knew if their state allowed them to deliver the vaccination, and only 42 were aware of current legislations. The 55% were willing to administer COVID-19 or the flu vaccine. And right now, only 2% were currently administering routinely the vaccine. And what was interesting to notice, though, is that the dental hygienist, in 91% of the cases, indicated that a dental hygienist should be involved in vaccine administration. So dentists really believe that dental hygienists could also play a role in cancer prevention if we consider, for example, the HPV vaccine. There are plenty of really good informations out there for the dental community on HPV and HPV vaccination. Team Maureen has a great toolkit available online for dental providers with tips on how to talk about HPV, on how to refer patients for HPV vaccination if the dentist doesn't provide the HPV vaccination. And they have a very friendly, user-friendly website online. We did a lot of work with Team Maureen over the years in promoting the HPV vaccine and educating providers and patients around the association of HPV and HPV-related cancers. The American Dental Association also has material on oral health and the HPV vaccine, with up-to-date information on the epidemiology of HPV-related cancers and what the dentist can do to prevent these cancers and how to discuss HPV with their patients. In 2018, the American Dental Association adopted a policy supporting the HPV vaccine. And we know from studies that a strong provider's recommendation is still the #1 reason as to why parents decide to vaccinate their children. And we know that patients tend to see dentists more often than their pediatricians or primary care providers. And that's why we believe that dentists really play a major role in educating their providers on HPV and HPV-related cancers, and possibly also be involved in immunization programs. So to summarize, we saw that persistent high-risk HPV infection causes the majority of oropharyngeal cancers, followed by cervical cancers and others. And we have a very safe tool, which is the HPV vaccines, that offers oral protections and prevents many of the cancers that are associated with HPV. And dentists can play a major role along with dental hygienists in educating patients on HPV and current available preventative strategies, the importance of vaccination and early detection of some of these cancers, although most common, the oral cancers. Thank you very much for joining us today, and feel free to email me at alessandro.villa@ucsf.edu if you have any questions. Thank you again.
Hi, so as Susan mentioned earlier, unfortunately, Dr. Villa is not able to join us live. So if there are any questions, feel free to either ask them in the chat, or you can ask them out loud. And if someone on the call feel comfortable answering them, they can. If not, I can take the notes and then pass it on to Dr. Villa, and then we'll be sending out like a Q&A Word doc after this. Any questions or comments? Show of hands on the call. Are any of you all working with dental providers at the moment, or interested in working with dental providers? You can put your hand raised. Okay, you can use the reactions if you are or not. So there's a couple. In terms of those who are working or interested in working with the dental providers, are there what part of the developing or implementation phase are you on, and are there any like tips that you'd like to share with the group, or any asks or any questions that you may have for those who may be further along? I'm gonna call on Teresa because I see her hands raised.
Hi there. So what we've done is mainly just work within the communities. And so for instance, in the case that I'm talking about is we worked with Marshall Medical Cancer Center, and we were able to work with a dentist in Placer County, and actually in El Dorado County, to do a little like health fair kind of thing. We had the dentist speak on oral HPV infections, what it might look like, what they would do to investigate, and then everybody, we of course did the questionnaires afterwards to see if people learned information from the dentist. It was really, really a great little, it was probably attended by 20 some odd people. It was, of course, back in 2019. So it's a little hard to remember all of the details, but it really went over very, very well. The people that attended felt like they got some great information. And I feel like, and you guys can all attest to this probably, that the dentist has more time. The dentist and the hygienist will always be able to spend more time with the patient, as opposed to maybe a primary care doc or someone like that that's on a 15-minute schedule, and they have to see you and basically move you on. Where a dentist is actually more conversational, I feel like. So everyone that attended this really felt like they got a lot of great information.
And then Shashari, I think your hand's raised as well. I think you're muted, or we can't hear you.
Hello, can you hear me now?
Yes.
Okay. Hi, my name is Seshadri, and I'm a pediatrician here at Bay Area Community Health. We are an FQHC, and thank you for such a great presentation. So I wanted to share two things we had tried, and this was like right prior to COVID. So after that, we hit some roadblocks. So one of them was we have in Santa Clara County a clinic where we do like multi-specialty. So we do have like family medicine, pediatrics, and we also have dental chairs. So what we did was we did it both the ways. So it was a medical dental collaboration where we had patients, let's say like a 1-year-old or a 2-year-old who had never seen a dentist, after having a physical with a pediatrician, would be done a warm handoff to the dental providers. And the dental providers would in turn send the teenagers over to us for like an immunization visit after they briefly spoke about like, oropharyngeal cancers and HPV, and they came on over to our side. So since it was on the same building and floor, and we shared like it was very easy, but I think after COVID hit, the numbers dropped for dentists too, and we are picking it up. So that's what we were doing. And then I moved to a different clinic, but within the same medical center, but we do not have dental dentists at the same building. So it's like 2 blocks away. So I don't think they're able to do like the warm handoff on the same days, but we are looking into like doing the HPV to talk by the dentist to the patients, but we have never tried a dental hygienist doing this or the dental clinic itself as a setup for this. So this was great. It's just food for thought. Thank you.
Okay, and then I guess this question is about whether Dr. Vila's slides will be and stats will be available in the resources that he provided. Shante, will they be on our website?
We'll check with Dr. Via, but everyone will get an email from me on the recording and things like that from the meeting. So.
Okay, and then Darlene had a question about if anyone knows if HPV vaccinations include in the scope of practice for RDHs. If not, we can ask Dr. Vila. And then someone also asked, do dental offices stock HPV vaccines, or do you know of any dental offices that do stock these vaccines? And is it reimbursed by medical insurance or dental insurance for those who have done this? Okay, so we can definitely pass those information along. Okay, so Adele also asked the question about the American Dental Association, so we can pass that question to Dr. Vila as well. Oh, here's the CARES question. So how do dentists track whether HPV vaccine is due? Do they use our care registry? Or do they have access to our care registry? Okay, so these are all questions that we can definitely get answers to. And if the folks are interested in the reimbursement policy, okay, so we can definitely get answers to all those questions. And is there anyone in the group that want to share any updates? We have a couple of minutes left. Does anyone have any opportunities they'd like to share, or any resources or news or announcements?
Hi, this is Dr. Tracy Ville from the Immunization Coalition of Los Angeles County, and I will put a flyer in the chat for an upcoming forum we have on vaccines overall, the state of vaccines, that will be hosted in Los Angeles and available through recordings elsewhere. So I'll put that document in the chat right now. Thank you.
Anyone else? I think, okay. If that is it, I don't know if Irene want to spend a couple minutes talking about the announcement approach.
I can. I don't know whether Shantae has found funding to resume doing trainings or not, but I guess a couple of years ago, I was trained in the announcement approach of discussing HPV vaccination with parents who had questions. It's an approach that was developed by Dr. Noel Brewer at University of North Carolina, and it is similar to other methods of vaccine communication with potentially hesitant or questioning parents that I participated in at Kaiser Permanente, but specifically geared toward HPV. And he had done a large study in multiple different clinic settings with a randomized controlled trial showing that this method of discussing vaccination with parents was effective in increasing acceptance of the vaccination and vaccination rates in those clinics. And the basic concept of the approach is to tell parents that an HPV vaccine is due, where many providers, I think, make an error in asking parents if they want HPV vaccination for their children, where they tell them that they need tetanus vaccine and they need meningococcal vaccine, and then they ask them about HPV, implying that it's less important or optional, or that there should be a reason why they wouldn't want it. And so based on that whole concept of normalizing the HPV vaccine as part of the normal recommended immunization schedule, rather than treating it as something special and different, increases acceptance. And the training that we received as trainers, and then that I then trained several different clinics, involves how to answer common parental questions and concerns as they come up, but not to make an initial presentation that can accidentally cause concerns where there aren't any. And it saves providers time, because the parents who do accept the vaccine as recommended, you don't need to have a big discussion with anyone. And it improves provider satisfaction and also increases vaccination rates. And it was very well received in the several clinics where I presented it, including the one that I had retired from. So.
Thank you, Dr. Landau. And to answer her question, we will be offering the training again. So we'll do some promotion a little later on once we have all of that information available. But if you are interested in being trained, you can just send us an email. And again, we'll send out some more information to let folks know about that. Just wanted to note our future learning collaborative dates. Our next one is July 20th, and then the last one of the year will be October 19th. And I want to thank you all for joining us today. You can learn more about the work of the Roundtable if you visit our Roundtable website, as Dr. Park went over. And if you have any questions, please send them through our email there. And again, as we talked, about we see all of the great questions that are in the chat for Dr. Villa, and we'll make sure that we get all of those answered for you and send them out.
Okay, I think that's all we have. So thank you, everybody.
Julie, there was one more slide, I think.
Is there another slide? I'm sorry.
There's another slide because I want to make sure everyone has a chance to answer the evaluation. There. So this could be you. You could be rejoicing at your computer because you just won $25 for an Amazon gift card. So we just want to encourage everyone to please fill out our evaluation. It helps make these sessions better. Let me drop it in the chat here. And again, we will be emailing everyone for follow-up. We want to thank everyone again for joining us. And again, we'll be following up by email with the questions from Dr. Villa, as well as the evaluation link.
So thank you, everyone.
Thank you all.
Yeah,
See you guys
thank
all in
you.
July. Bye.
See you next time. Take care.